There is a move in the lower house that seeks to boost the HIV-AIDS prevention program in the country. This followed increased HIV-AIDS incidents in the past few months. More from Freddie Abando.
Despite the intensified information campaign to contain the spread of AIDS in the country, 2014 figures from January to June reveal an alarming rise of patients infected by the HIV virus. Of the 2,320 HIV-positive cases, 218 are full-blown AIDS cases. 96% were male. The 20 to 29 age bracket accounts for 58% of those infected. Female transition is only 88. 94% contracted the disease through sexual contact of male to male, 5% through needle sharing among drug users, and only 1% through mother-child transmission.
HIV/AIDS is a public health issue today. It is spreading significantly, especially during the past 3 to 4 years. And there is no way, despite all our public advocacy and public information, that we will be able to achieve our MDG target of either preventing its continuing increase or eventually really reducing the incidence. And so therefore, the government, the Department of Health is faced with this issue.
Because of this, the House is amending the law which is implementing the comprehensive AIDS prevention policy of the country. A key provision is how testing will be conducted to ensure the prevention program is more effective and efficient. Initially, the Health Department proposed mandatory testing with penal provisions imposed if a suspected patient refused the process. However, the proposal came under fire in the House and was condemned by civil society groups as illegal and violates human rights.
We're not comfortable with that. Secondly, how do we intend to carry out mandatory testing? It's going to be a logistical nightmare. As you're going to have it nationwide, because that's what I understand when you say mandatory, then that means Filipinos. And third, we need to really also look into experiences in other countries, whether mandatory has been effective in curtailing HIV infections. There are studies that says it's not, and now the Secretary is saying that some countries have adopted a more proactive stance of testing, not necessarily mandatory, but at least exercising the police power of the state in having routine testing.
In a technical working group of the House Health Committee, Secretary Enrique Ona agreed to adopt a different strategy acceptable to all. HIV screening will be conducted as a routine for medical care. It's either a patient will agree or decline the test. The committee will still finalize the details of how the testing will be conducted.
What we are really just proposing is a certain relaxation or liberality, and that's why we would propose a routine testing. Second, it has been shown today that if is early, is given early to a patient with HIV/AIDS positive test, that you actually prevent them from getting the frank disease. And so therefore, in itself, ordinary testing and finding that if a particular patient is positive, it essentially is protective of him because you are able to treat him early.
For the People's Television Network, this is Freddie Abando reporting.